Thank you, Mr. Chairman and members of the committee. I'm Mike Dark, a staff attorney at California Advocates for Nursing Home Reform, a nonprofit established in 1983 that advocates for Californians in long-term care. When people move into nursing homes, they leave behind families, friends and neighbors, their places of worship, their professional identity. They've given up most of what people have to give their lives dignity and meaning. Often the only thing they have left is the facility they live in, the people they meet there, the other residents and the staff. Being forced to leave a nursing home for another facility was universally understood to be traumatic before COVID hit, which is why, before COVID, residents and their families had the right to participate in identifying another facility to go to. A huge problem we have right now with COVID is that restrictions on visitation make it impossible to visit new facilities to make sure that they are clean and safe and adequately staffed. What this bill asks is to temporarily extend to vulnerable nursing home and ICF residents the same kind of protections against eviction that residents outside congregate setting are already getting under many state and municipal rules. The bill currently explicitly permits transfers to general acute hospitals for medical reasons, which is appropriate. But in its current form, it would also permit attending physicians contracting with facilities to transfer residents on a non-emergency basis to other skilled nursing facilities and ICFs, a rule which would be inconsistent with current transfer laws and could be easily exploited. CANHR would respectfully urge that this issue be dealt with by a simple amendment. One thing that does stand out about the opposition letters filed by industry interests is that no one is even disputing that it is impossible right now for an evicted resident or their family to visit potential new facilities to make sure that they are appropriate. And none of the arguments they do offer in opposition are compelling. The bill would not keep facilities that are in genuine financial straits from discharging residents, but it would require that they file a petition for Chapter 11 bankruptcy first. The proposition that the law isn't needed because of existing protections simply misses the point that key existing protections like being able to visit a transferee facility first have already been suspended as a result of COVID visitation restrictions. Finally, it is Orwellian to suggest that a bill temporarily halting evictions of the old and the sick during a pandemic would interfere with patient care. It's not concern for patients, but desire for profit that is driving the closure of facilities like Sakura ICF in Los Angeles. We should be able, as a society, dealing with a devastating public health crisis, to delay that kind of profit-taking for only a short time. I urge your yes vote.
Thank you very much. I believe we have another witness.